Let's talk about premature ovarian failure. Premature ovarian failure is also known as premature ovarian insufficiency or early menopause, and it's a condition in which the ovaries lose their normal function before the age of 40. It's characterized by depletion or dysfunction of the ovarian follicles, leading to reduced estrogen production and irregular or absent ovulation. The exact cause of premature ovarian failure is often unknown, but it can be influenced by various factors, including genetic, autoimmune, and environmental factors. Several risk factors increases the likelihood of developing premature ovarian function, and they include certain genetic disorders such as Turner syndrome and Fragile X syndrome, and these are associated with an increased risk of premature ovarian failure. Having a family history of premature ovarian failure or early menopause can also increase the risk. Autoimmune disorders such as Hashimoto's thyroiditis and Addison's disease have been linked to an increased risk of premature ovarian failure. Treatment of clients with certain chemotherapeutic drugs or radiation therapy targeting the pelvis can damage the ovaries and lead to premature ovarian failure. Certain medical conditions such as celiac disease, hypothyroidism, and diabetes mellitus similarly may increase a client's risk. The symptoms of premature ovarian failure can vary amongst individuals, and some may experience no noticeable symptoms. However, when present, symptoms may include irregular or absent menstrual periods, hot flashes, night sweats, vaginal dryness, mood changes or irritability, decreased sexual drive, difficulty conceiving or getting pregnant, fatigue, cognitive changes such as difficulty concentrating or memory problems. Diagnosing premature ovarian failure involves a combination of medical history, physical examination, and laboratory tests. Your healthcare provider will inquire about symptoms, menstrual history, family history, and any other previous medical condition or treatments that could affect ovarian function. Blood tests measuring levels of follicle-stimulating hormone, luteinizing hormone, and estrogen can also help determine ovarian function. In premature ovarian failure, the follicle-stimulating hormone levels are typically elevated. Ultrasound scan may be used to evaluate the ovaries and assess their size and appearance. Genetic testing may be recommended to identify any specific genetic causes associated with premature ovarian failure. While premature ovarian failure cannot be reversed, treatment focuses on managing symptoms, maintaining bone health, and addressing reproductive concerns. Treatment options include use of hormone replacement therapy. In this particular situation, estrogen and progesterone replacement therapy can help alleviate symptoms, maintain bone health, and protect against long-term health risk. In some cases, individuals with premature ovarian failure may still desire fertility or pregnancy. Options for such include oocyte preservation or egg freezing, or the use of donor eggs if they plan getting pregnant. Counseling or support groups can help provide emotional support and help individuals cope with the psychological impact of premature ovarian failure. Regular health checkups and screening are essential to monitor bone health, cardiovascular health, and other potential long-term health considerations. Coping with the diagnosis of premature ovarian failure can be challenging. However, there are some strategies and support options that can help the client. It's important that the client learns about the condition, the treatment options, and available support resources. Talking to loved ones could be helpful too. Joining support groups or considering counseling could also help a client process emotions and navigate through the challenges of premature ovarian failure. If pregnancy is desired, the client can consider options such as adoption or surrogacy. Discussing these options with healthcare providers and reproductive health specialists could help go a long way in assisting the client manage premature ovarian failure. Engaging in self-care practices, maintaining a healthy lifestyle, and prioritizing activities that promote physical and well-being will also help such clients. Premature ovarian failure can have long-term health implications beyond reproductive concerns. These considerations include reduced estrogen levels, which increases the risk of osteoporosis. Hence, adequate intake of calcium and vitamin D, weight-bearing exercises, and regular bone density screening are important. Estrogen deficiency may increase the risk of cardiovascular disease. A heart-healthy lifestyle, including regular exercise, eating a balanced diet, and maintaining a healthy weight is essential. The emotional impact of premature ovarian failure should never be underestimated. Seeking support, counseling, or therapy can help individuals cope with the psychological challenges associated with this condition. Premature ovarian failure can have a significant impact on an individual's reproductive health, emotions, and overall well-being. Understanding the causes, symptoms, diagnosis, treatment options, and coping strategies can empower individuals to navigate the challenges and make informed decisions about their health and fertility. Support from healthcare professionals, loved ones, and support networks is crucial in providing the necessary care, guidance, and emotional support throughout the journey of living with premature ovarian failure.